Hi, it's Dr. Linder. We're still on the digestive tract. We're going to look at the teeth in this video. The teeth are small, hard, bony structures that are located in the oral cavity. And there are some key structures and names to be familiar with. Enamel is one, dentin, the crown, the root, the gingiva, cementum, and the periodontal ligament. So the enamel, that's the outer layer of the tooth, and it's also the hardest substance of the body. That's enamel. The dentin are these bony tubules that are located under the enamel, and it forms the basic substance of the tooth. The root canal is the internal area of the tooth. It's the space that contains the arterial, the venule, the lymphatic vessel, and the nerve. We heard of people that have a cavity very deep that they need a procedure called a root canal, where they destroy all of this, including the nerve, due to the increased pain and sensitivity they have to temperature as well as pressure. The crown is the part of the tooth that's located above the gingiva or the gum, whereas the root, that's the part of the tooth that's beneath the gingiva or the gum. The gingiva is the gum, and the cementum is this bony-like substance that connects the root to the periodontal ligament. The periodontal ligament forms a flexible anchor for the tooth. The periodontal ligament also provides a little degree of movement of the tooth. It gives it a little bit of flexibility so that the tooth doesn't break every time you chew. It allows the tooth to slightly alter its cutting surface, which really increases the efficiency of chewing. So when we look at the tooth, here is the crown. Remember, that's the part above the gingiva. The neck is just below that, and the root is the part below the gingiva. Here's the enamel. Here's the tubules that make up the bulk of the tooth. These are called dentin. These are the dentin tubules. Here's the gingiva. Here's the cementum. Here's the periodontal ligament. And here's the root canal. Here's the bone. Again, here's the crown, the neck, and the root. The enamel is above the gum. Here's the dentin. Here's the gingiva or the gum. Here's the cementum. Here's the root canal. Here's the alveolar bone. Here's the periodontal ligament. And then here's the nerve and the vascular supply that's going in the root canal. Okay, and then this dilated part of it is called the pulp cavity. So when we look at the teeth, these are the permanent teeth. Right in the center, we have central incisors here and here. And just lateral to it is the lateral incisor. As we move posterior, we get to our canine right here. There's our canine. And then we have our premolars. This is the first premolar. And here's the second premolar. Okay, sometimes these are called bicuspids. And then we have the molars. We have the first molar, the second molar, and the third molar. And it kind of shows you, not just the order, but then it gives you the time frames. Okay, these are the time frames that they typically come in. A dental carie. This is a cavity, right? The sophisticated name for a cavity is called a dental cavity, carie, which is the erosion of the tooth tissue. The oral cavity contains many kinds of microorganisms, and some of the organisms are bacteria. There are good bacteria in the mouth, and there are some that could be bad. Having good oral hygiene is important. If you have bad bacterial overgrowth, there is known strains of bacteria that are linked to dementia and Alzheimer's, and there are strains of bacteria in the mouth that are also found in the heart during heart disease. So using antiseptic mouthwash is very, very bad for the mouth. Don't want to do that. The bacteria assist the body in preventing many types of infections in the mouth. So the good bacteria here are supposed to outweigh the bad bacteria. The bacteria, however, metabolize food residue like sucrose on your teeth, and they produce a lactic acid. And that type of acidity can actually decay and break down the enamel of the tooth. So what will dentists do? They'll drill out the decayed part of the tooth, and then they'll pack it with a filling. The filling that dentists use is called amalgam, and amalgam is made of nickel and mercury and silver. Hopefully dentists at this point in time are moving away from using this and using more of the white fillings. But most people, if they're 40 or older, tend to have a lot of the silver in the mouth, and we try and get these patients to have them removed professionally by a dentist that's properly trained by removing this, because it's not good to have mercury that close to the brain. There's a pretty neat YouTube video. You could Google it and find it. I'm sure it's called The Smoking Tooth, where they actually show what happens to the mercury in a tooth that's 30, 40 years old. And once you see it, it's an eye opener. So people with neurological diseases, whether it's MS or Parkinson's or Alzheimer's, should really remove any type of metallic influence from the body, whether it's in their mouth, whether it's the aluminum that comes in deodorant. They have to be very, very careful with it. Nickel and mercury are neurotoxic. It can cause certain symptoms in susceptible people. So this is just showing different depths that a dental carie can take. So in the top one, it looks like it's just breaking through the enamel. Now it's in the enamel and the neck. Now it's breaking into the pulp cavity, and down into the actual root canal. So here's two holes, one here, and then this will be filled by a filling, and this is what dental fillings look like. On an x-ray, this is what a cavity would look like, right? These hollowed out, radiolucent areas. They look like these darkened shadows. That would be a dental carie or cavity. When someone has one that's been neglected, it can lead to a root canal and a root canal procedure. So when someone has a root canal issue, their sensitivity to heat, and even pressure, when they bite into something, it's just extremely painful. So that's when the cavity extends through the tooth and it reaches the root canal, and the teeth can become very weakened at that point because it's losing a lot of its foundation. When that happens, you can get bacteria that accumulates inside the root, whether it's staph. Here it looks like this pyogenic bacteria called Staphylococcus, even strep, certain strains of Clostridia, and the bacteria give off gas, and it creates this pressure in the tooth that they can feel, and it creates an abscess, tries to wall it off, and then there's more pressure that they feel. So the root canal is typically done by a type of dentist that's called an endodontist, and they'll grind down the tooth, remove the blood vessels, remove the nerve, and when the nerve has been removed, the endodontist will pack the tooth with canal packing material called gutta percha, and then the dentist will insert a post in the tooth and then eventually a cap to cap it off. So this is the root canal procedure. You can see they drill all the way down, and they remove the blood vessels and the nerves, and then they fill it with the packing material, and then they put a crown on it, which is quite expensive, probably around $1,000 just for the lab to make that porcelain crown. Here's what it looks like. Here's an x-ray of a root canal. You can see the crown here on top. Here's another crown. You could see the root is already packed with the gutta percha. Sometimes you can get bacteria from them that can spread if it's a strep or staph, and it can spread into the heart, creating what's called an infective endocarditis, where they get this bacteria that affects the valves of the heart. That's why this stuff could be very, very dangerous. Remember, I said earlier that the bacteria in the mouth can spread up into the brain, and it can spread down into the heart. In terms of plaque or tartar, that's the substance that's produced by bacteria when it mixes with sugar and starchy foods, which prevents the removal of bacteria from the mouth. The bacteria can produce acids, and those acids can break down enamel. Dextran is the foundation of plaque. It's the sticky substance that can cause other materials to kind of adhere to itself and the tooth, which could be very problematic. The prevention is really proper oral hygiene, brushing the teeth several times a day, morning and night, to remove all the sugars and the sucrose from the mouth. And eventually, if need, they do plaque removal. So they can use a ultrasonic scaler, they can use the hook, which can scrape the teeth, and we could use abrasive dentrifice, which is what we call toothpaste. This is a picture of healthy gums, nice and pink. This is plaque. You could see the accumulation. This becomes very, very dangerous overall. If you have a healthy mouth, healthy teeth, healthy gums, that's a great indicator of a healthy body. When you have a mouth that isn't healthy, you have a body that is not healthy. Years ago, when I had a dog, the vet would say, "Have you ever had a dog before?" I said, "No, this is my first dog." She lived, happy, healthy 15 years. She said, "Here's the key, doc. Healthy mouth, healthy dog." I said, "Wow, fantastic. Same rule with humans. Healthy teeth, healthy gums, healthy mouth, healthy individual, healthy body." So keep that in mind. Simple advice. Here's gingivitis, red, swollen gum line. Gingivitis, inflammation of the gingiva. Now, in terms of the teeth, their primary function is chewing. We call chewing mastication. You chew the food long enough to help facilitate swallowing. Chewing decreases the size of the food and increases the surface area that allows the digestive enzymes to break it down, right? It's the difference of swallowing something like this and only having the digestive enzymes work on all four of these, or breaking these down, right, into these small bits. And when you chew and you break it down into these smaller, chunks, now you can have these digestive enzymes that just don't work on four sides of the food. It's working on all sides of this, all sides of this, all sides of all of it. So it increases the surface area for which the digestive enzymes can actually function. It's breaking down the cell walls of the plant in order to release the nutrients contained within the cells. Some of them are pretty strong, like you could chew garlic, and by threatening and chewing raw garlic, it releases allicin from the garlic, and allicin is antiviral, antiparasitic, antibacterial, very, very strong stuff. In fact, this is very controversial, but it helps to explain why when people modify their diet and become a vegetarian, many become very sick. Now, I'm not bashing a vegetarian diet, because I know many that get very healthy on the vegetarian diet. I know many that get sick on ketogenic or Paleolithic, and some that get healthy. But on certain individuals, certain individuals are highly sensitive if you think about wanting to kill an animal can defend itself, it can run, it can bite you back, right? It can defend itself. You chase after some leaves on a plant, it can't run away, but it can bite you back, right? We see this with poison ivy. If you touch it, it releases something that can really disturb you. But plants release a lot of enzymes, that of which could be toxic to people. This is true for many, many people. I have had patients who converted to vegetarian and their joints become so inflamed and hurt that they have to go back to carnivore diet. Then I have some that are on a carnivore diet that are extremely inflamed. And when I put them on a deviated diet, we go more vegetarian based, everything clears up. So keep in mind, there isn't one way of eating, it's the right way for that individual who has a certain biochemical individuality. And each of ours is slightly different. What works for one person may not work for another. And what worked for one particular individual during a phase of development in their life may not work 10, 20, or 30 years later. The demands and needs of the body is always changing. In terms of the mouth, there are some cranial nerves that are involved in chewing and tasting and moving the tongue, right, and digestion. So cranial nerve 5, which is the trigeminal nerve controls the muscles of mastication. Those are the time muscles, the temporalis, the internal pterygoid, the masseter, and the external pterygoid, TIME. Temporalis, I for internal pterygoid, M for masseter, and E for external pterygoid. It also deals with sensation. Trigeminal nerve deals with sensation to the face, but it also, not the ophthalmic, not the maxillary, but the mandibular branch of the trigeminal nerve deals with pain. When you bite on your tongue, it's the trigeminal nerve that's picking that up. In terms of sweet, sour, and salty, that's the cranial nerve 7, the facial nerve, sweet, sour, salty 7 to the anterior 2/3 of the tongue. And bitter back 9, the glossopharyngeal nerve, deals with the taste of bitter to the posterior 1/3 of the tongue. And cranial nerve 12, hypoglossal, is involved in moving the tongue. Genioglossal, hypoglossal, they help manipulate and move the tongue all around. So you have many cranial nerves involved in digestion. When we come back, I'm going to talk about the hard palate, soft palate, and something called MTHFR, methyl tetrahydrofolate reductase.